So, what can be done to improve written and verbal communication and to try and avoid some of those things that were mentioned in the previous slide? So, as mentioned before, SBAR is super important. It provides kind of standardized communication, so everybody knows really the format that these interactions should be having. So, if something's missing, it can be a little more obvious to the person saying it and the person hearing it. It kind of gives you an extra step to go through everything. Also, really important for verbal communications, especially if you're getting verbal orders from a doctor, would be to repeat back essential information. So if they give you a prescription, you want to make sure you repeat that back as well as the dosage, and they need to confirm that for you. So again, just an extra step to make sure mistakes do not happen. Also, a big one that hospitals are now using is incorporating technology in the communications, especially between doctors and nurses or specialists and nurses. So what that usually looks like is a secure messaging system. And the great thing about that is it cuts down on the time needed to get a hold of a doctor, basically. So you can send them a message telling them what's going on with your patient. They usually have access to that pretty much right away. If they're in a patient's room, they're going to get it as soon as they are done helping that patient or doing whatever they're doing, and they can just message you back directly. Kind of cuts down the waiting time. It cuts down on having to leave messages for people, like on answering machines. This also does provide direct documentation that you can see exactly what you sent and what was sent back. So if there is ever a mix-up or a mistake or anything like that, you really have the proof of, no, this is exactly what was said and what was done about it. And it has timestamps, everything you need right there. So that is really cool. And really, it's been proven to help. According to recent studies, hospitals have already seen a huge improvement by using these secure messaging systems. So, there's improved wait time, there's improved patient outcomes, improved patient satisfaction overall. So really a good tool that thankfully hospitals are getting on board and definitely using.